So good afternoon everyone. So for today's return demonstration, I'm going to perform essential intrapartum and newborn care or EINC. Okay, prior to woman's transfer to delivery room, so we have to do this first. So hi ma'am, my name is Logan. I'm your nurse for today. I'm here to guide you and to help you. So can I ask you a question, ma'am? So okay ma'am, so are you comfortable on your position? Okay, ma'am. Do you want to eat or to drink something before we go to the delivery room? Okay, ma'am. So your vital signs, ma'am, are stable, and your cervix is dilated to 7 centimeters. So it is normal, and it's okay. So that's it, ma'am. Okay, so woman is already in the delivery room. So next is to preparing for delivery. So first of all, to check the temperature in the delivery room. So what we do, it should be 25 to 28 degrees Celsius to eliminate aircraft. Okay. In checking temperature, we are going to use a piece of paper. If it goes down just right in front of me, it means the temperature is right. Next is to ask the woman if she is comfortable in the semi-upright position, the default position of delivery table. Next is to ensure the privacy of the woman. Next is to remove all the jewelry, then wash hands thoroughly, observing WHO 1, 2, 3, 4, 5 procedure. So now, I'm going to wash my hands, observing WHO 1, 2, 3, 4, 5 procedures. Is to prepare a clean newborn resuscitation area. Check the equipment if clean, functional, and within easy reach. Next is arrange the materials and supplies. We have kidney basins, gloves, dry linen, plastic clamp, scissors, and a bonnet. And also the oxytocin injection. Separate sequence for after the first breastfeed. We have eye ointment, vitamin K, we have the BCG vaccine, hepatitis B vaccine, and some cotton balls and a stethoscope. Next is clean the perineum with antiseptic solution. Next is to wash hands and put 2 pairs of sterile gloves aseptically. At the time of delivery, encourage the woman to push and decide, like inhale, exhale, and push. Inhale, exhale, and push. Next, drape the clean dry linen over the mother's abdomen or arms in preparation for drying the baby. Next, apply perineal support and do controlled delivery of the head. Next is call out time and sex of the baby. So the time is 3:45 p.m. and sex is a female baby. And inform the mother of the outcome. Here you go, mother. You have a healthy female baby. In the first 30 seconds, thoroughly dry baby for at least 30 seconds, starting from the face and head, going down to the trunk and extremities, while performing a quick check for breathing. In 1 to 3 minutes, remove the cloth or linen. Place the baby in skin-to-skin contact on the mother's abdomen or chest. Cover the baby with dry cloth and the baby's head with a bonnet. Exclude a second baby by palpating the abdomen in preparation for giving oxytocin. Use a wet cloth to wipe the soiled gloves and give IM oxytocin within 1 minute of baby's birth, and then dispose of wet cloth properly. Remove the first set of gloves and decontaminate them properly in 0.5 chlorine solution for at least 10 minutes. Next is to palpate umbilical cord to check for pulsations. After pulsation stop, clamp cord using the plastic clamp or cord tie to 2 cm from the base. Place the instrument clamp 5 cm from the base, and then cut near the plastic clamp, not midway. Perform the remaining steps of the AMTSL. Wait for strong uterine contraction, then apply controlled cord traction and counter traction on the uterus, continuing until placenta is delivered. Next, massage the uterus until it is firm. Inspect the lower vagina and perineum for laceration tears and repair for laceration tears as necessary. Next, examine the placenta for completeness and abnormalities. So far, the placenta is complete and it is a good sign that there is no abnormalities. Next is to clean the mother, flush the perineum and apply perineal pad, napkin, or cloth. Next is to check the baby's color and breathing. Check the mother's comfortable and uterus contracted. Next is dispose the placenta in a leak-proof container or plastic bag. Decontaminate, soak in 0.5 chlorine solution the instruments before cleaning. And decontaminate second pair of gloves before disposal, stating that the contamination lasts for at least 10 minutes. So advise the mother to maintain skin-to-skin contact with the baby, and then baby should be prone on mother's chest like this one, and in between the breast with head turned to the one side, like this. Okay. Did you get it, Mama? Okay. So, 15-90 minutes. So, first of all, I'll advise the mother to observe for feeding cues. So, for example, turning her head, rooting and sleeping, opening her mouth, sucking her thumb, and crying for the last sign of hunger. Okay. Next is support the mother, instruct her on positioning and attachment. Wait for full breastfeed to be completed. After a complete breastfeed, administer eye ointment to support for the prevention of gonorrhea. Do thorough physical examination. Next, administer vitamin K to prevent blood clotting. Next is hepatitis B. It is to prevent some liver disease. Next is a BCG injection that helps the child's immune system fight the germs that cause TB and helps stop them from getting serious TB disease. And advise the mother on, first of all, of course, to optional delayed bathing of the baby. Next is breastfeeding per demand. And of course, in the first hour, check the baby's breathing and of course the color. And then the mother's all vital signs, and then massage the uterus every 15 minutes. Next is to in the second hour, check the mother and the baby every 30 minutes, and every 30 minutes and to 1 hour. Next is to of course, to complete all the records given by the patient and the baby. That's it. Thank you.